ties with Syria, which were suspended in 2011 when an uprising against the then leader Bashar al-Assad expanded into a 14-year civil war. Now, since December 2024, after Assad was ousted from power, more than 3.5 million Syrians have returned to their homes. Many, however, are dealing with increased health needs caused by the war. To help us understand the current situation on the ground in Syria, I'm joined now by Rachel Sider in Damascus from Relief International, which has just released a new report on the healthcare issues the country is facing. Rachel, thank you so much for your time. Given that you're currently in the Syrian capital, just how critical is the situation in the country right now when it comes to healthcare?
Well, we're really warning of a looming public health challenge as a result of the fact that the healthcare system has been completely fractured by these 14 years of war, by displacement, by the depletion of staff, resources, capacity. And what it means for Syrians that we as Relief International are working with is that they're dealing with undetected illness, untreated disease, and trauma, much of which is causing additional challenges as they seek to return home and rebuild their lives. They're facing clinics that have been shuttered, teams of skeleton medical crews, and rising healthcare costs and other transportation challenges that make reaching even basic care all the more challenging.
Your report, Rachel, highlighting that malnutrition is now prevalent across the country. What needs to be done immediately in order to correct that?
That's right. Child malnutrition presents a really significant issue of development and growth for children across the country. We're seeing high levels of malnutrition, in particular in places like Deir ez-Zor Governorate in the northeast part of the country, where access to food, nutritious food, high food prices, and the cost of living being a special burden to families who are trying to recover from this conflict. And what needs to be done about it, I think, is threefold. On the one hand, it's really about targeting some of these nutrition services that are provided by organizations like Relief International into primary healthcare service provision and scaling up nutrition services within primary healthcare. Secondly, it's investing in that at the national level through the work of the Ministry of Health, which we know has really stated and clear priorities around nutrition as it relates to primary healthcare. And I think third is really tackling some of these structural challenges that come with high cost of living, reducing food prices, and other day-to-day challenges that make coping with life and therefore feeding and caring for children and mothers all the more difficult.
And your report also talks about how somewhere around 86% of women are reporting anxiety and psychological distress. Now, even in nations with the best funded healthcare systems, gaining access to psychological help can be far from easy. So how can you prioritise such care in a country which is still struggling so much?
You're right. I think this points to a much bigger challenge in Syria, which is that not all of the wounds are visible, right? And that this is one of the significant consequences of years of compounding conflict and displacement that many Syrians are facing, and women in particular, as a result of high care burdens, economic stresses, the fears and worries that come with reintegrating into a country, recovering from war. And I think we all know that this is a stigma and a challenge that we deal with in many contexts, as you've mentioned. And tackling this really starts at centering Syrians' health and well-being as a core consideration in the recovery process, and investing in that and at a nationwide level, because we know that peace in Syria really depends on peace of mind at the individual level first.
Now, of course, this is all happening against a backdrop where funding to international aid and NGO groups has been massively slashed. So with that in mind, what should the international community do?
That's right. I think many of the healthcare services that are reduced at this moment are a result of some of the cuts in international funding that we've seen. And that's why we are really calling on international leaders, including the European Union, that's meeting with Syrian officials today in Brussels, to scale up sustained and long-term investment in Syria's health system, first and foremost. Secondly, to support an enabling political environment for that investment to take shape and to support the sorts of service delivery that our report calls for. And third, that there is a collective commitment and support for the priorities that are outlined by the Syrian Ministry of Health in its own strategic plan, which is a guiding framework for all of us when we think about how to be inclusive and thoughtful about the needs and healthcare considerations of all Syrians, whether they're making their way back home to the country or they're still in displacement.
Thank you. We're going to have to leave it there. Rachel Sider from Relief International, many thanks again.
Thank you.
Now, beleaguered